Hello, welcome into another episode of Manta Care's Patient from Hell podcast club. My name is Mike Lynn, and I'm a patient advocate here at Manta, and I'm going to be your host today. And today I have a great guest. Her name is Melanie Sisk. She is a metastatic breast cancer patient advocate, and we're going to be talking about the Patient from Hell podcast, specifically episode number 56, in which Samira and Karen Wernley were discussing the ramifications of breast density and imaging and how it plays into the decision making of both potential and then current breast cancer patients. Now, really what this means is we're getting an opportunity to talk about how things that are done in research, concepts that are being put forward to test patient experiences, how they can be studied and improved upon in the future. Because when we talk about cancer treatment improving over the course of, say, 10, 20, 30 years, well, how did we get here? It's with, patient experiences like this and anecdotes that supplement the very strong science that is coming along. With that in mind, today's episode is funded by the Patient Center's Outcome Research Institute, or PCORI. The goal of this collaboration is to bring doctors or researchers onto the Patient from Hell podcast to share about their research so that more of us can learn about it and use it to help us in our lives as patients or care partners. The podcast club then gives us the opportunity to chat with members of our community to get their perspective on an episode. So like I said, I have Melanie Sisk. And Melanie, give me a little insight into your background as a patient and an advocate.
So my name is Melanie Sisk. I live in North Carolina. I was a nurse in my former life, I say. That was when I was still working. I was working in nursing and was diagnosed with metastatic breast cancer in 2020. So it took me a little time to really digest that diagnosis. And after I, came out of work and on disability, I thought, you know what, I'm going to jump into advocacy and learn all that I can and do all that I can for metastatic breast cancer before it ultimately takes my life.
Well, you're a better person than me. It took me 2 diagnoses to get to advocacy, but it's important because the only way that, or not the only way, but a significant way in which patients can feel better about the experience is by comparison, by seeing other people relate what they're going through. And that's a little bit what we're going to talk about today. We're reacting to episode 58 from the Patient from Hell pod, in which Samira, the founder of Manta Cares, and Dr. Karen Wernley talk about the practical aspects of how breast cancer is diagnosed. And before we get into the specifics of the episode, one thing that struck me with this episode in specific, I've done a lot of these podcast clubs and reactions, and I've watched now all of these PCORI episodes for Manta, is the kind of emotional connection that these 2 women had in their shared diagnosis. And you can tell that the passion they had in their work was incredible. There's a lot of content on the internet about any topic imaginable, and it's rare that you watch something and you can see each question just profoundly impact them. It was going back and forth. I thought that was fascinating. But past that, it was Dr. Wernley talking about her life's work, how she got into this sort of research role in which she learned about, these little inflection points that can make a big change potentially down the line because she's studying how this works, and that's something that I think is very cogent, because I know that when I was going through my diagnostic process, which is for stage 4 metastatic melanoma, not quite the same as metastatic breast cancer, but a lot of cancer has a lot of parallels. I was kind of flying blind, and I was dating a medical professional at the time. I, have a great support network around me. I have a good, provider. I have all the resources, but it's still just an overwhelming time. And so when we look at it retrospectively, when I look at what I was doing retrospectively, it's easy for me to say, oh, I might have done this differently. Maybe I would have approached this differently, but that's not the reality of what most cancer patients face. So with your experience in a breast cancer diagnosis, tell me about that. How did you feel, the options were laid out to you? And now looking back on it, do you think there were things you might have changed?
So for my diagnosis, my story kind of started really early back. My mother had premenopausal breast cancer at the age of 47. So that meant that I had a first degree relative who had breast cancer. So I would start my screening at an earlier age than normal at that time. So at that time, I started my screening at the age of 35. So I would have, screening mammograms every year. And I know on the episode, they talk about breast density. And at the time, I didn't know that breast density was alone a risk factor for breast cancer. But I did know back then that I had very dense breast tissue. And I could look at my different mammograms from year to year, and one would be C, which is heterogeneously dense, and then D, which is, extremely dense. So it would alternate. And right, we know that's subjective material, right? It's what the radiologist says it is, right? So I knew that I had dense breast tissue. And along with the other factors of breast cancer, like, I breastfed my kids. So that's supposed to be good, and, different things like that. So I started my mammograms at 35. And then at the age of 43, at that time, I was already doing 3D mammograms, because we know that's better for extremely dense breast tissue. So I was doing 3D mammograms, and at the age of 43, that's when they found my breast cancer. And that was in 2016. So even back then in North Carolina, like me as a patient, I already knew that I had dense breasts, but I didn't really know what that meant for me. I didn't know that was a risk factor alone. I just knew that it meant that it would be harder to find the breast cancer on imaging. That's kind of what I thought back then. And so that was in 2016. And I was treated at an NCI designated cancer center. I had stage 1A breast cancer. I had a low OncoDX score of 12. I did everything right. I did the surgery. I did the radiation. I was on endocrine therapy. And I was told, hey, go live your life. You're done with cancer. And then in 2020, that's when we found that I had metastatic breast cancer to my bones. So that's kind of how my story started. And looking back on it, I don't think I would change, even looking at my surgery option. Back then I had a lumpectomy radiation. And if you compared it to mastectomy, there was no overall survival between one or the other. And, I had a 10-year-old and a 12-year-old. I was working as a nurse, 12-hour shifts. I didn't want to, be out of work as long. And we factored in genetic testing. So since my mother had breast cancer, we tested me for any of the known breast cancer genes, which I was negative. So that's when I decided, okay, I'll do the less invasive surgery, which is the lumpectomy radiation, so I can get back to work, get back to my family quicker than the mastectomy. And even now, looking back on it, I wouldn't change anything, because even if I would have had a mastectomy back then, I would still be in the same situation I am now with stage 4 breast cancer. The outcome would have been the same. So, I'm that patient who did everything right. I started my screenings early. I did them every year. And then lo and behold, I was diagnosed with breast cancer.
Yeah, and it's an all too common story in that, the more we live in the world of cancer, I think the more we learn that it's not necessarily the things you do, it's just the things that happen. And, incidentally, my partner right now, she has a genetic history of, breast cancer in her family. She has dense breast tissue. She's going through all of these screenings, and, she's been with me throughout these last 2 recurrences of my cancer. So she's well exposed to the process of all these things, and it's still convoluted as to what is best, what she should choose. And when she stresses about it, I kind of say the same thing that you said. I've had things in retrospect that I looked at and said, okay, maybe that's not what's recommended today, because the process is always evolving. But it's hard to regret the things you do, or I don't personally want to regret the choices I made, because we're working with the information that we have. And, as studies like these come up, as conversations like these come up that give new patients the opportunity to maybe have a better experience, I'm happy for that. But I think at some point in time, you have to make peace with all of the variables in cancer. Otherwise, you're going to legitimately go crazy. And, we don't need that on top of legitimately going crazy some of the time anyway. So you said that it wasn't really breast density, wasn't necessarily brought up as an independent risk factor, but you were well exposed to advanced screenings because of your family history. I think, and also you brought up the non-regret factor of it. In your advocacy, have you talked with other women who have brought up, maybe a lack of resources or a lack of information in this, and then subsequently they might have some regrets about how they were treated? Is that something you've seen?
I have seen that within the breast cancer community as well, too. I think in my case, I was very fortunate that, I had screening early based on my family history. I was aware of it. I was treated at an NCI designated cancer center. I'm treated by a breast specialist oncologist. Some of the patients that I've talked to may be treated by a general oncologist. And no fault to them, they treat all kinds of cancers, right? They don't just focus on breast cancer. Or if you have a breast oncologist, that's all that they do. And so I think they can stay more on top of the guidelines and the new clinical trials and research, et cetera. So I have had patients that are not in the area where they can be treated at a designated cancer center, and they're treated with just a general oncologist. So they are not aware of all the options available to them. And even ones that maybe are, there's always people out there who don't have the knowledge or the resources to be able to get the care that I think they deserve. So yes, I have seen that.
Yeah, I think you brought up a great point. I know that in my experience as a cancer patient and then as a patient advocate, I've been exposed to the information that I believe is good surrounding my diagnosis and cancer broadly. Like I said, as a stage 4 metastatic melanoma patient or a stage 4 breast cancer patient, these are actually two of the cancers that are highlighted most in terms of screening. I think it's pretty well driven into society that for women, it's make sure you get a mammogram at X age. For people in general, it's make sure you're wearing sunscreen, make sure that you are getting your skin checked. And there's probably several other cancers that get the kind of press that breast cancer and skin cancer get in terms of screening, but like they're very broad messages. The message of get a mammogram or get your breast checked or get your skin checked, wear sunscreen. It's not something that like sticks in your brain past that messaging. As a person who doesn't have cancer, in both my experience and then talking with other people, everyone's vaguely aware of it. But the more we get into advocacy, the more we learn that there are very specific things that we can tell people who are A, not exposed to cancer, or B, have been exposed to cancer and now need to learn how to take care of themselves. What kind of messaging, for breast cancer patients or people who have a family history of breast cancer is a little different than just go get screened at 35, whatever age it is. Is there something that you would recommend to people who are in a situation where they have a family history or they might be worried about their chances of getting breast cancer?
Definitely. If they're worried there's a genetic component, always, advocate for genetic testing to see if they have one of those mutations for breast cancer. If they do have a family history, they know they need to start screening early. But the truth is, as far as breast cancer, only about 15% of new cases have a family member with breast cancer. So 85% of all newly diagnosed breast cancer patients have no family history at all. So to me, that might be an increased risk factor, but to me, it's not enough. And, I think too, most people think when you hear breast cancer, they think, oh, well, that's the easy cancer for women, just like prostate cancer for men. But I'm here with stage 4, and I'm here to say, no, that's not the easy. And one thing that I have learned since jumping into advocacy is 30%, approximately 30% of all early stage breast cancers will later be diagnosed with metastatic disease. So to me, that's a really high number. And I think there needs to be more education about this. And you hear, early detection saves lives, and it does, but it doesn't save all lives. So
Right.
that's something I think, the population needs to hear. But we do have those screening mammograms, and, we know 3D for dense breasts, and then we have MRI. The main thing I could say for patients, because a lot of patients are being diagnosed earlier than 50 years old. So I think the guidelines need to change, I think it's 40. The guidelines need to change where, if you're a patient and you feel something and it doesn't feel right, and you go to your doctor and they say, well, I don't feel anything, I think you're good. No, go on your instincts. If you believe something's there, you advocate for yourself. You say, look, I'm not happy. I feel like something's there. I'm really concerned. I think we need to order extra imaging or MRI or whatever the case may be. You really have to speak up for yourself.
Yeah, absolutely. I'm 7 years into this, and I just got a freckle taken off of me last week. 2 weeks after seeing my dermatologist, for a scheduled checkup, there was a freckle that changed slightly, and she and I were on the same page. I said, "Hey, just for peace of mind, just take this off of me." You brought up an incredible point about advocacy too, in that the numbers, while 30% seems astronomical for a metastatic recurrence, and when you start to kind of parse that out in your brain about breast cancer numbers there or whatever form of cancer, the one thing that Wernley and Samira were speaking about in the episode is that once you're in the world of cancer, it seems like everyone is affected, whether it is, the people in your own wake for your own diagnosis, but then you start to notice it more. People start coming to you as a resource, even outside of your theoretical advocacy lanes, or you start to hear about it more, or you start to encounter people in the wild where you say, hey, I have the same lived experience. And you start to understand that there's a few components of advocacy that are really, really cathartic. To me, it's almost this form of therapy to be able to talk about my own experiences with people who understand it, like yourself. I mean, this conversation for me, like I said, we're doing something that is supposed to be providing information, and I hope we are, but this right here feels good because we're connecting in a world where it's hard to be understood by people who haven't gone through it. Have you kind of experienced that as well in advocacy? Has it taken on, a heartwarming role in your life?
It really has. You think about breast cancer, everyone has, like Samir said, everyone has been touched in their life somehow. It may not be them, it may be someone in their family, but it's around. In breast cancer, we know 1 in 8 women. If you think about, 8 women, one of those women will be diagnosed with breast cancer in their lifetime. So to me, that's a really high statistic. So yeah, advocacy for me has been it kind of gives purpose to my own suffering. It's kind of how I look at it. I want to move the needle. I know that whatever I do as far as like for research and things like that, it may not benefit me, but it'll benefit people after me. And one of the roles that I really take on in advocacy is like education. And I think empowered women empower women, like what I can share, what I can learn, then I can bring back to my local community, and I can share within my local community and with the communities that I'm with online. So it really does. It's really lethargic for me to be able to talk about my story. And everyone, I think, when you go through anything in life, no matter what it is, just like you with the stage 4 melanoma, when you can talk to someone who's in the same boat as you with the same diagnosis, that's so heartwarming, because then you know that, okay, I'm really not alone. There's someone else who really gets everything I feel and everything I think. Because sometimes we have, thoughts and we think maybe I'm just crazy, but then when you talk to other people who are in the same boat, you're like, no, they get it, so,
Yeah, you hit it on the head there. I mean, those thoughts of, am I crazy, or does this happen to other people? When you hear someone else going through it in the same boat as you, it is really empowering. And specifically, in this case, for women who are going through not only cancer, which has been a historically taboo subject. If you go back a few decades, not that I was experiencing this, but I've talked to enough people now, and they say, look, 40 years ago, someone said the big C, and you just stop talking about it. And then breast cancer specifically, the diagnostics and the treatment for it have gotten so much better that these are now topics that need to be talked about, so that it doesn't feel clinical or sterile to have, the person relaying the information all the time. It helps to just see people who have gone through it. And I think, this is a good segue into wrapping this up. That's what the PCORI episodes are for. We get to see clinicians and doctors and someone running a cancer organization talk about it, and then it gets distilled so we can discuss it. So on that note, is there anything else you want to bring up in regard to, breast cancer, breast imaging, your experience?
I think really all women, get that screening done. If it's not good enough to your liking, if you feel like something's wrong or something's not right, ask for more, advocate for yourself. So, because that's the only way that at least we have those tools, right? Some cancers don't have good screening tools. So we are fortunate in the breast cancer community that we do have mammograms, we have ultrasounds, we have MRIs. So definitely advocate for yourself. Even if you're under that age limit for recommendations for it, advocate, push for it. Your doctor may say, "Oh, you're okay." Don't accept that. You need if you need that for peace of mind, and you never know, because so many women are being diagnosed earlier in this day and time. So I think it's so important, and I love what they do. All the researchers for cancer. I mean, hey, that's what brings us new drugs down the pipeline and hopefully extends our lives. So it's very important work that they do, and I really appreciate it.
Yeah, it's perfectly cogent as we sign off. Basically, is the more we speak up, both as individuals and as a community, the better off everyone is going to be down the line. So, Melanie, I want to thank you for coming on and speaking up. It's been really fun talking to you. Even in the context of something that is not always fun to discuss, I think that's another thing that is great about these is it's been fun for me because I know we're helping people. So thank you for coming on today, Melanie.
Yes, Mike, thank you so much for having me. I really enjoyed it.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Mantacares Inc. or Mantacares' sponsors. This episode was supported by an award from the Patient-Centered Outcomes Research Institute.